What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last full prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay. The place to buy and sell new, pre-loved, vintage, and rare fashion.
Excuse me, waiter. This coffee tastes like mud. Yes, sir. It's fresh ground. What do you call a skid mark that won't come out? Undeterred. Did you hear about the dirty Easter egg hunt? It was hosted by the Dust Bunny.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve. My little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative medicine ass hats. Hello, Dr. Scott.
Hey, Dr. Steve.
And Tacie, my partner in all things. Hello, Tacie.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at drscottwm. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, blah, 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 whatever. And Tacie, I understand you're going to be leaving and then coming back later in the show, and that's fine. And we'll see you then. And Dr. Scott, everything going well on Simply Herbals. Thank you. Thank you. Tacey's looking at me confused, but I'll explain in a minute.
Sprays. Lots of nasal sprays.
Okay, yeah. Check him out at simplyherbals.net and check out stuff.drsteve.com, stuff.drsteve.com for all of your Amazon needs, and patreon.com/weirdmedicine, where we do our Tacie and I do our Patreon over there, including the exam room where we have celebrities call in and ask us questions. And then I'm doing Cameo still, cameo.com/weirdmedicine for $8, something like that. I'll say fluid to your mama. So there you go. All right. Thank you. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And check out our website, as I said, at drsteve.com. So, all right. How's it going?
Awesome.
Yeah, you had a good week?
Pretty good week.
I don't give a shit.
I know.
So
it was nice of you to sound semi-sincere.
To pretend.
Semi-sincere. I was just burning up like everybody else in this part of the United States.
That kind of sucks a little bit, but it's I hear it's going to get better. But no one tunes in to us to listen to us talk about the weather.
Prognosticating the...
So what kind of medical news do you have for us this week, Dr. Scott? Anything weird and wonderful and odd?
Well, one thing that's really pretty wonderful is the fact that there is a new diabetes drug out that's helping patients lose weight like they've never seen before.
Oh, really? What is the drug?
So the drug is called tirzepatide.
Okay,
was that close?
That's pretty damn good.
I've been practicing. I actually read this 30 seconds before we came on, so I figured
it's that notorious Dr. Scott show prep.
Yes, I worked so the drug works on two naturally occurring hormones that help control blood sugar and are involved in sending fullness signals from the gut to the brain. Yeah. So that whole feedback mechanism, which is really important to keeping us from feeling hungry all the time. What they noticed is that the folks who have diabetes were losing weight and lost up to 21% of their body weight. Yeah. In some cases, that's 50 to 60 pounds, Dr. Steve.
Yeah, that's a big deal.
That's a big deal. And the great news is it helped with a lot of people. There, just a couple people dropped out of the study because of some GI upset.
And that's real classic with these
pretty
drugs.
Pretty common.
I mean, that's one of the ways they help you lose weight is by making you sick to your stomach.
You poop yourself to death.
Well, no, it's
so nauseated.
Yeah, just make you nauseated. But
you can't eat. Yeah.
I'm looking at this article in the New England Journal of Medicine, which is a pretty highfalutin medical journal. Right. And this is where they were looking at it just for obesity alone. Okay. And it was a phase 3, double-blind, randomized controlled trial. Ooh, very good. Those are the ones we like. Yep. And they assigned 2,539 adults with a body mass index greater than 30. So obesity is characterized as 25 or more. Overweight is 25 or more. And so these people were obese, or if they were 27 or more and had at least one weight-related complication. And that had to exclude diabetes in this case. Okay. So it could be osteoarthritis of the knees, I'm assuming, something like that, some of those kinds of things. And then they were to receive once weekly subcutaneous tirzepatide 5 milligram, 10 milligram, or 15 milligram, or placebo for 72 weeks. So I'll give them credit for this one, too. They took their time. And they weren't in a rush to get this thing to market, which is nice. They watched people for a year and a half. And then they had a 20-week dose escalation period on top of that. So it was really 92 weeks. Okay. That's a so it was almost, it was right at
pretty lengthy study.
2 years, right?
Yep.
Well, just under 2 years. And their co-primary endpoints, remember, you have to decide what your endpoint's going to be. What are we really looking for? And it was percentage change in weight from baseline and a weight reduction of 5% or more. So at baseline, the mean body weight was 104.8 kilograms. So let's ask Echo what that is. Echo, what's 108 kilograms in pounds?
108 kilograms is about 238 pounds.
Well, it was 108.
By the way...
No, I don't care about the bio weights. Echo, stop that. And so the mean BMI was 38. It was actually, mean body weight was 104.8. But you get it. These were, people with who were overweight. And 95% of the participants had a BMI of 30 or higher. And so the mean percentage change in weight at week 72 was minus 15%. So we can figure this out. Echo, what is 85% of 104.8?
85% of 104.8 is 89.08.
89.08. Echo, what's 89 kilograms in pounds?
89 kilograms is about 196 pounds.
So they went from 230, 240 down to 190 something on average, right?
Mm-hmm. Yep.
And so that's they have estimated that if you can lose 5 to 10% of your body weight, you can reduce your risk of sudden death and other complications significantly. So that's a big deal. So this stuff, of course, will be insanely expensive in the beginning until they lose their patent. But I got to tell you, I don't know how much it costs to do one person for 2 months and have all the different centers. I mean, this isn't just done in one office. This is done in offices all over the place. They got to pay everybody, got to pay the nursing staff, the laboratories who do the blood work, everybody. I mean, these things cost a lot of money to run.
About $100 million, I think, is what it is to get a new drug to market.
Just this one?
Going through all the
I thought
trials.
Some of them were like $1 billion.
Well, I'm sure. I'm sure it could do a whole lot more than $100 million.
I have a friend who's been on this show. Well, he might not want me identifying him that way, but I have a friend who is on a drug for an unnamed malady, but it's a rare. It's an orphan drug, and he had to do 6 shots, and each one of them are something like $800,000 a shot. Insurance paid for it, and I'm sure they discounted the shit out of them. But if you were paying cash, that's how much it would be.
Yeah, well, they were saying these drugs, they're kind of ballparking early estimates $1,000 a month for these.
Yeah, so that's a lot for 12 months. If you're going to do it for these people, did it for 18 months. So you're talking 18 grand to lose enough weight to really improve your outcomes. And if your insurance pays for it particularly, that's probably a pretty good deal if you've tried everything else.
Yes.
So, and our goal is to save lives, but also quality of life. It does improve your quality of life.
Mm-hmm.
And, I've seen people who talk about, doctors are fed the same bullshit that we are about weight, and weight isn't unhealthy, and, being overweight isn't unhealthy. And it's not, look, the problem isn't what we're fed, if you know what I mean. So I'm sorry. That was terrible. But it is indisputable that if you are overweight and you get a wasting illness like cancer, that your odds of living longer are higher. There's no question about that. But overweight also contributes to disease states significantly, including malignancies, including diabetes, which then leads to heart attack and stroke and all of those things. So the risk-benefit analysis is still better to manage your weight and get it down before you get ill, rather than going, once I'm overweight, I might as well stay this way because because I have less likelihood, or I have a improved survival if I get cancer. That isn't really, to me, that's not a compelling argument. It is to some people. There are some people, they get mad at me for even saying that there's any health benefit to losing weight, but it is. If you look at if you care about the data, the data is absolutely there.
Yep. And I think the other interesting thing about this drug is just think about a lot of the people that we have that have joint replacements early, and then they start adding weight because they can't get up and move, and then it gets worse and worse. And sometimes dropping that weight will allow them to get up and be more active and to heal quicker. So I think there's a lot of great benefits to it.
Well, and then there's just the lifestyle stuff. I mean, are you not sick of having to buy? I mean, I agree. It sucks. You have to buy 2 seats for an airplane, or you can't ride rides. I mean, I broke my heart. There were 2 people in front of me at Tennessee Tornado at Dollywood, and they couldn't get the lap thing. I know, it was awful, and they had to get up, and they were, you know what? It would have been not so bad if they'd been in the back. They were in the very front 2 seats. So every single person in line and everybody sitting in the ride, saw this. And I felt horrible for them. But I'm sure they felt worse about it.
Yeah.
And then there's the whole Dollywood thing that I love to tell, that I've told a couple of times on this show, that there is a sign at Dolly's Splash Country that's the double, and I shouldn't laugh, that the double tubes are for an adult and a small child not to exceed 500 pounds total. Now, if you have to make a sign for that, an adult and a small child and combined weight is more than 500 pounds, they had a problem.
Yeah.
Something happened on that ride for them to make that sign.
Yeah.
And so anyway, if you get kicked out, that's something.
Yeah, that's good.
It's a lifestyle issue.
It is.
Anyway, all right. So Terhubadant. Terzepatide. God, now you got me doing it.
I said it pretty.
Terzepatide.
That was pretty quick.
Oh, look who's here.
The boss.
Here's the boss of all bosses. Hello. How are you? I'll turn your mic on as soon as you flip that switch. So Tacie's here, everybody. And she has been... and nobody cares about our kid or anything.
I think it's on.
Yeah, it's on.
It's hot.
Nobody cares about our kids' excellent grades or any of that stuff, but he is now searching for an apartment because he's not getting along with his roommates. And that is... Can you help her? Because she's plugging. Yeah. I'm sorry. She's plugging in. Is that working?
Yes.
Okay.
I was afraid. Okay. Yeah, those things weren't working for me the other day.
Yeah. Okay.
Are you sure that's not just him wanting to have his own place so that his girlfriend can spend more time over there?
Yeah. No, she can spend time over there now, but they're just they were best friends in high school and now not so much, and that kind of sucks. I hate that. But you never know till you live with somebody what they're really going to be like.
Did you play that funny phone call that we got about Liam?
Oh no, I don't know. I don't know where that is. But somebody, I may have cut it off. But it was somebody called and just asked if Liam found his wallet. And because Tacie and I think that was a Patreon show. And Liam called and said he couldn't find his wallet, so Tacie left to go find it. Were you here?
Yeah.
Scott? Okay. No, it wasn't a Patreon.
I was there, yeah.
Anyway, so somebody called, left a question, and at the end they said, did Liam ever find his wallet? The answer is yes. He found it, and it was right in front of his nose the whole time. It's a black wallet, and he had left it on a book called Berserker, which is a manga, and it's got a black cover, and so it was a black wallet on a black book, and he just couldn't see it. So I bought him one of those Apple discs so that I can track him wherever he goes, but also ostensibly so we can find his wallet if you're losing it. And it's like, dude, so let's talk a little bit about absent-mindedness. There are people listening to us that lose shit all the time. Yes. I'm one of those people. I have figured out a way to compensate for that. Mm-hmm. And that is by developing strict habits about certain things. So one thing, and Tacie, and I'm going to tell the story about what happened this weekend that shows why this is an imperfect system. But I know my wallet is in my right front pocket, and my watch is on my arm, obviously. My phone is in my pocket, and also my key. So those are my three things. And the only two places that my wallet ever is in my pocket or on my nightstand. The only place, okay? Same for my phone. It's either in my pocket or on my nightstand. That way, if it's not in my pocket, I know it's effing on my nightstand, okay? And I've been telling Liam, wallet, nightstand. And then, I left it in my car. That's by the way, some 19-year-old dumbass shit where they've never been exposed to anything bad in this world. Well, I'll just leave my wallet in the front seat of my car, and then it's like, dude, come on.
Don't do that.
So anyway.
It's an invitation for trouble.
It is, well, yeah. I mean, don't give somebody a reason to break into your car. But so I've developed this. So this is the key: is you have to develop these habits because you're always for absent-minded people, you're going, well, I'm going to put my keys right here, and I'll remember where I put them, and then you don't. Yeah. And then they're in some godforsaken place that you don't remember. Well, okay, so this weekend, couldn't find my fucking glasses. Couldn't find my glasses. My glasses are either on my face or on my nightstand. Right. But I've kind of gotten in the habit of taking them off in the bathroom when I'm getting ready for bed, and sometimes leaving them there saying, I'll come get them in the morning. Not there either. Not there. Not anywhere in the bathroom. Not in the tub. Not in the drawers.
Not under the bed. Not
right. Looked under the bed. Oh, I did find a pair of glasses there. Those were Tacie's glasses. Tacie's glass. No, not too bad. She has OCD worse than I do, so it was driving her crazy. But I did find glasses under the bed, and they were Tacie's that she had lost 1 million years ago. So that was something. And I found 2 of the dog balls that they Ralphie lost when they did his spaying.
And we found
neutering.
a beeper.
I'm just kidding. And I found a beeper that I lost about a year ago.
How many years ago?
So anyway, but couldn't find my fucking glasses. Couldn't find them. And I just said, whatever. They'll turn up. I know they have to be here. They were in my pants pocket with my keys.
Oh, jeez.
Which I never go into my pants pocket for my keys because my car has one of those proximity locks. Yeah. Why the hell?
You should cram your glasses in your front
I crammed.
Scratch them up.
I was getting ready. I put my wallet in my front pants pocket. I put my phone in my back pants pocket. I put my keys and my glasses in my left pants pocket like a dumbass. And we looked everywhere, and then it was like, stupid asshole. So I came downstairs. Of course, I had to cop to it because it was funny because it's so dumb. So these things don't always work, but they work better than not doing that. So if you're absent-minded, you've got to develop those sort of proximity things. And then be checking all the time. I'm always telling the boys, when you go from the car to the restaurant, do your inventory. Wallet, keys, phone. When you go in, and then you sit down, and then when you get up, wallet, keys, phone, and then when you get back to the house, wallet, keys, phone, until you go to bed that night. And if you'll develop that habit, you'll lose these things a lot less than you normally do. That's a real common thing. Is for people to be, particularly in this day and age, the things that, and you think, oh gosh, I've got dementia. No, that's not a sign of a dementia exactly. It is a sign of anxiety, stress, a lot of stuff on your plate. Yeah. And those things, those intrusive thoughts will bust in and destroy your short-term memory, the scratch pad memory, and then you just have completely forgotten where you put something. All right?
Just remember, the opposite of forgetfulness
is what?
Presence. So being present, you forget less.
Oh, I know another one. The opposite of forgetfulness is?
I forget.
I forgot. Okay.
That's hilarious.
All right. Yeah, I'm going to say Scott ruined that one. All right.
I can take it.
All right. We had a question in the waiting room. So when we are referring to the waiting room, what we're talking about is a small group of people who, because we're on at the same time when Anthony has Gavin on. There are a lot of people who watch that instead. I don't blame them because they know they can hear this later. But if you want to hang out with us, we're on YouTube. Just go to our YouTube channel. Follow us on Twitter or our subreddit or YouTube. I said YouTube or Facebook, and I'll put out a notification, and then you can come in and check it out. And so we have people in the waiting room. So I see Amanda Swan and Darren Parker and Sean Pedrick and other people like that. They're just hanging out. And I'm not going to do like Stuttering John and sit here for 20 minutes and list everybody that's in the chat room. But you can hang out and then you can ask questions, and Scott usually picks them up. And one of the people, was it Sean that was asking about viral meningitis?
Oh, didn't see that.
Okay, well, anyway, one of the people in the chat room had a child or, a family member who was a child who had viral meningitis. Now, viral meningitis obviously is meningitis. That's inflammation of the lining of the central nervous system. Those things are called meninges. and it's a very common form of meningitis. If I had to choose between viral and bacterial, I'll take viral because in adults, for the most part, it causes a chronic headache.
Okay.
And most people get better on their own without treatment. Now, non-polio enteroviruses are the most common causes of viral meningitis in the United States. So a lot of people get these enteroviruses, and very few of them will develop meningitis. But mumps can do it. Herpes can do it. Herpes encephalitis is a rough one, and that one usually requires IV medication. Influenza can cause meningitis, but these I've been doing this 35 years, and all of the viral meningitides that I've seen have all been non-polio enteroviruses. And so anyway, these people will get fever, irritability, poor eating, particularly in kids. They'll just go off their feed. They might be lethargic, hard to wake them up from sleep. And, common symptoms can also include fever, headache, stiff neck, that kind of stuff. And so they'll diagnose this by doing lab tests, and sometimes they'll get a stool sample. Other times they have to do a lumbar puncture, which is where they stick a needle in your back and get some cerebrospinal fluid and look at it under the microscope. So in most cases, there isn't any specific treatment for the viral meningitis, and most people who get it, if it's mild, get better in 7 to 10 days.
Good.
And antibiotics don't help.
No.
So there you go. So that's that, and hopefully the kid follows the normal course, has a real mild syndrome, and just gets better quickly. All right?
Good.
All right. You got anything else over there?
Yeah, well, Darren Parker was asking last week and tied it into this week. I guess he started having maybe some cardiac concerns.
Okay.
He started taking Crestor. He was prescribed Crestor, started having some sores on his scalp.
Well, Crestor is rosuvastatin. That is a statin, Dr. Scott's favorite.
Yes.
All right.
They anyway, we'll skip past that part. But he was asking, really a two-part question. He was asking if we've ever heard of anyone that has scalp ulcerations or sores.
Absolutely.
Yeah, with Crestor.
Statins are known.
Because a bunch of terrible stuff.
Oh, whatever. Statins are known to cause...
Keeps my triglycerides under control.
Eczema. Well, that's by God, that's anecdotal evidence there, Taste.
That's right.
Eczema. It can cause a cutaneous version or form of lupus, even.
Yeah, which is not
Porphyria cutanea tarda, which we've talked about on this show before. It's often associated with liver disease. Bullous dermatosis. Bullous dermatoses are dermatoses, pathology of the skin that cause blistering. So you can get big sort of fluid-filled blisters. They can also cause phototoxicity. In other words, people, all of a sudden, they're on a statin.
They're really sensitive to sunlight.
Lifeline has got to stop calling me. Hang on a second. Let's just take this call.
No.
Hello? Yeah, that's what I thought.
Well,
okay, so
photosensitive.
So those people will go out, and all of a sudden, God, I just go outside, and now I get sunburned all the time.
Quickly up. Well, there's a second part to this story.
Yeah.
So
yes, that is a possibility, and it is unusual. A lot of providers will miss that for a day or two. They're used to hearing about muscle aches and pains,
neuropathies,
and that kind of stuff.
Yeah. He was talking about. So I guess he took maybe he's not on right now. He's traveling, but he said that he decided to go get a calcium score of his heart.
Okay,
and the number of scores were elevated, and he went because and we're going to give him credit for this in memory of GVAC. He went to have his calcium. Thank you very much for doing that. And
let's talk about the calcium score just for a second.
Yeah, sure.
It's just a test that they do with a CT scanner that is done between cycles. It literally takes 30 seconds to do. When I did my last one, they said, hold your breath And then by the time I let my breath out, they're like, okay, you're done. That's really?
I remember you. Yeah.
And what it does is it looks at some imaging of the heart and the blood vessels in and around the heart, and then it calculates this thing called a calcium score. And it gives you sort of an idea. It's not a perfect test, but it's a good screening test to see if you need something further done.
Yep. So I guess because of his calcium score, they sent him straight over for a stress test.
Oh, so what was his score?
Well, he didn't say, and like I said, he's on the road, so
okay.
But he must have called in and said to ask you about high altitudes and suicide rates. Did you get an email?
I don't know. Let's do one thing at a time, though. Let's talk about the calcium score. So they sent him straight over, and then what?
Well, and then he dropped off. He's going on a road trip, so we'll have to find out.
So he never had. Wait. Oh, he's gone.
Yeah. He's gone now.
For fuck's sake.
Hey,
okay. I'm with you.
I'm just the messenger.
So a score of 0 means that they don't see any calcium in the heart, and then a score of 100 to 300 means moderate plaque is there. Plaques are just places where calcium and other, fibrous tissue are building up in the heart or the coronary arteries. And that is associated with a relatively high risk over the next 3 to 5 years. And then a score of greater than 300 is a sign of very high to severe disease, and they would send somebody over.
Right on.
So that probably is what happened, and I would love to know what if he's driving around. I'm assuming that his stress test was okay.
Yes, one would assume so,
because they. I had a nuclear stress test once, and what they're doing with that is basically they stress you, and then they give you an injection of a substance that will bind to areas that are currently metabolizing oxygen. Mm-hmm. And then and it's also radioactive, so they'll put you in front of a scanner. So if you have a blocked coronary artery, obviously that part of the heart muscle is not using oxygen, and it won't bind to that, and it'll show up as a hole or a dark spot. So anyway.
Well, cool.
There is so on to the second part of his question that he's not able to listen to. There is one study that shows a positive relationship between average state altitude and suicide rate, but correlation is not causation.
Right.
So Utah, the average geographic altitude is 6,000 feet. Rate of suicide is 70% higher than average. But remember, those are relative numbers. The absolute risk, we could calculate that. Matter of fact, put that down for next time, Scott.
Gotcha.
We will calculate the absolute risk of suicide when you're moving from, say, what's the lowest altitude be? Like what, Arizona, maybe? From there to Utah.
Yeah, South
And then
Florida.
you're going to see, well, true. Okay, right. It's at sea level.
Yeah.
So, but I think there's some parts like Death Valley's below sea level, right?
Yeah.
So we'll look at that, and then we'll calculate the absolute risk, and you're going to see that absolute risk is pretty small. All right?
Yep.
Maybe we'll do it on the podcast this week. We'll see.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly. which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
The last thing you want to hear when you need your auto insurance most is,
"Thank you for calling. Please listen to your list of 46 possible service options."
Which is why when you choose USAA Auto Insurance, you'll get great service that is easy and reliable. 24/7 online service for claims, access to roadside assistance, and more. All at the touch of a button. Start getting the service you deserve. Get a quote today. Ability to receive a quote depends on membership eligibility. Membership eligibility and product restrictions apply and are subject to change. USAA means United Services Automobile Association and its affiliates, San Antonio, Texas.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
All right, what else you got? That it?
That'll be about all.
From there. Now, you had some other articles that you wanted to talk about.
Yeah, another article, and you've actually, I'm not sure where you got this, but it's about the changes to the brain.
Okay.
Following an injury.
Okay, what kind of injury?
TBI, so a head injury.
Okay.
So what they're saying is every year in the United States, nearly 2 million Americans sustain traumatic brain injuries, or TBI, and survivors can live with lifelong physical, cognitive, and emotional disabilities. And currently there are no great treatments.
Yeah.
Right. And we've all treated those and done our best to work with those. But they've known for many, many years that the brain tries to recruit and make new connections.
Yep.
And what they've found now is they may have a way to actually using some it's a weird process called iDisco. Excuse me. Yeah, I don't know. Just that's whatever the anagram is.
Donna Summer.
It's what it sounds like. But actually, being able to maybe transplant.
How do you spell it?
It's small I disco, capital DISCO.
Okay. iDisco.
Yeah. Of course, you're probably going to pronounce it like.
No, it looks like iDisco. For trauma, for TBI.
Yeah. But that's the imaging that they're using. So
okay.
As far as
these are
labeling
that's for creating maps,
right? And that's how they determine where these brain cells are communicating.
Yeah.
So they're hoping that they can use this mapping to either put in some new some gene therapy.
Yeah.
Like like they're doing with say the CRISPR, where they're modifying the genes, but they're hoping that they can actually create new pathways to reverse some of these TBI injuries.
Wow.
Which would be
okay. Well, that would be interesting. This is one of the immune system, which we're getting a handle on, and the neurologic system is a frontier of science that's still yet to be fully explored. We have no idea what makes consciousness.
No.
Do you know, Tace? Exactly.
Retirement. Retirement makes consciousness.
You think so?
Pretty sure that has something to do with it.
Yeah, so they use this process called iDisco, which uses solvents to make biological samples transparent. This process leaves behind a fully intact brain that can be illuminated with lasers and imaged in 3D with specialized microscopes. So I'm assuming they're doing this on people who are no longer with us.
Okay, probably.
I remember when I was in medical school, we were in some lecture, and there was the professor was showing slides of brains, right? Okay. And they were saying, well, this patient was in a motor vehicle accident and suffered a blood clot to this particular artery, and he showed us a section of the brain that had just a big giant blood clot in it. And some knucklehead in my class raised their hand in all seriousness and said, so what happened to the patient? Because we're taught to, you have to be empathetic, and that's not a wrong thing. I mean, it's the right thing.
Sure.
But this person was trying to show, who cares about all this? What happened to the patient? The professor just said, well, usually when you see sections of brains, you can assume that the patient didn't make it. So anyway, I'm assuming in this case, they're putting solvents in these brains and making them completely transparent and then probing them with lasers that these people have deceased.
Yeah, but what a really interesting thing I was reading about this, Dr. Steve, was that in a lot of these TBIs, what the problem is inhibition is lower. And certainly you'll see that even after TBIs, after someone's had maybe a surgery to their brain for a tumor.
Yeah.
It changes their personality and they lose some of these inhibitions. So what part of their research is actually to neutralize.
Have you ever heard of Phineas Gage?
I have, but I can't tell you why.
Okay, go ahead, finish, and I'll tell you his story in a second.
Yeah, but it's really incredible. So what they're actually trying to do with some of their cell therapy is to disinhibit these inhibitory neurons.
Interesting.
So they're not allowed.
Interesting.
Yeah, it was kind of cool. I didn't get all the way down through there, but I thought that's really
that
incredible.
Is interesting because you think someone's lost their inhibition, but to disinhibit the neurons would make them worse. But no, you're disinhibiting neurons that normally would inhibit the brain. It's a double negative, and it makes everybody very confused.
Yeah, isn't that crazy?
Yeah, Phineas Gage was this railroad construction guy. And what happened was this iron rod was driven completely through his head, and it destroyed his left frontal lobe. So that would be, obviously the left side of his brain in the front. And it caused all kinds of weird behavioral problems. And he's been a fixture in neurological research and just sort of the history of neurology forever. But he survived.
Wow.
It's so crazy that this guy survived this injury. And I'm just looking here. Let me see if I can see the kinds of things that happened to him. I said a tamping iron landed... it landed point first 80 feet away. If that tells you how powerful this injury was.
It bounced?
Yeah. Well, I mean, no, it went through his head, and it landed 80 feet away.
Holy moly.
Dang. So I guess they were blasting or something, and they had this tamping rod or maybe they were tamping this the charge down into the ground.
Oh, maybe, yeah.
And then it exploded and went just right through his brain. And
that just.
Yeah, he had all kinds of strange behaviors after that. One thing that, if you're interested, a really good book on these kinds of things is The Man Who Mistook His Wife for a Hat.
Okay.
That's a great book about weird neurologic injuries and stuff. And another one, I think written by the same guy, was one called Mind of a Mnemonist, and it's M-N-E, a mnemonist. And it was this guy that had this crazy malady that he could not forget anything. He was incapable of forgetting anything, and they would give him lists of 100 things, and then years later they would come back and ask him what was on that list, and he could name them. One time he made a mistake, and the mistake was that he forgot candy cane on this list. And when they said, "Why did you miss that one?" he said, "Well," and he thought about it for a second, and he said, "Okay, I see why I missed that. I had laid the candy cane against a brick wall, and when I walked by it, I just missed it because it blended into the brick wall."
Oh,
what?
Wow.
Yes.
Wow.
And his brain was just cataloging things constantly. He was walking around in this world.
That's insane.
Isn't that something? So there's all kinds of cool stuff. If you separate the right brain from the left, because there's this neurologic tissue going between the two called the corpus callosum, and when you sever that, you can do some really interesting experiments with those people.
Yeah.
They'll do that sometimes for people with refractory seizures, particularly back in the old days.
Yeah.
And in those cases, you could show something to the right side of the brain. Let's say you show a bunch of pictures.
Mm-hmm.
And one of them is a horse, and there's a way that you can just show it to the right side of the brain.
Sure,
you can do that through the
partition,
eyes.
right. Partition.
And the person would be able to pick it out of a lineup, but would not be able to say what it was that they saw.
But they can point to the word horse on,
or they
on
could point to the picture.
Yeah, I saw a similar
It's
thing.
nuts.
Yeah, I think we may have discussed this years ago, but it's very similar. A corpus callosum had been severed on this one gal, and she was showing how when she'd go into her closet, and she knew that she wanted to wear a red dress.
Yeah.
But if she went up with her left hand, it wouldn't pick a red dress no matter how hard
because it didn't want to.
It didn't want to. So it'd pick like that orange dress or the yellow dress and pull out. But her right hand or whatever would actually be able to go and pick out the
because
the
that's
dress.
that's
Just
wild.
Bizarre.
Isn't that
because
crazy?
They're fighting.
They were fighting.
There's two distinct things in there, and they
Totally right side,
they
totally
cooperate.
Yep.
But the left brain is where speech and all that, and most people, 99% of people, the left brain will be where speech and sort of executive processing is. But the right brain has very important functions, but it's mute. And if you
in other words, you can't say things.
Well, the right brain can't speak, but it has very important functions. So if you try to draw a face and you're not an artist and you haven't learned to look with the right side of the brain, the left side of your brain will go, well, I know what a nose looks like. It's a circle with two little holes in it.
Yep.
That's not what a nose looks like. The left brain is all about symbols and stuff. The right brain is about the shapes, but you have to shut up the left brain because it always thinks it knows better. So a really cool trick is to take a photograph of somebody and set it in front of you and draw from it with the picture right side up. And just draw and do the best you can. Try to draw what they, and then take that drawing and set it aside, turn it over so you can't look at it after you're done. Now flip the picture of the person upside down. So now it is upside down to you, and now draw it again, drawing it from that upside down perspective. And when you're done, look at both of the pictures, and the one that you did with the left side of your brain, which is when it was right side up, is going to look like a 2-year-old did it, unless you're an artist. If you're an artist, this doesn't work. But if you're a normal person that's a non-artist type person, that second picture will look much more realistic. And it's astounding, the difference, just with that one little test. So you can see the difference between right and left brain. And the right brain tends to be able to see the shapes, but you have to shut the left brain up, and the left brain can't understand an upside-down picture very well. Isn't that cool?
That's pretty awesome.
Fucking brains.
Yeah, that's cool.
Brains are awesome. All right. That's why zombies like to eat them.
That's right.
Hey, we've got one from Talk Like
Trying to get knowledge.
If you want it.
Yeah, what is it?
So Talk Like Hick to you. She has the female question of the week.
Okay.
Drum roll, please.
Okay.
Antiperspirants and deodorants for the vagina and
okay, Tace, you better take this
and
one.
ass. So, what is up with that? Do you think they're good or they're bad?
Well, I don't know. I mean, the science behind it, but I've used Lumi.
Oh, Lumi, what is that?
It's a
See, now you're talking some. This is Tacey's got a chick IQ of 120.
And we're like, huh? So is this like a refresher or
no? It's not an antiperspirant.
Okay.
Oh.
It's a deodorant. It smells weird when you put it on, but it does work.
Yeah.
Shut up. It does work.
When you say work, I mean it makes you not
stink.
Smell. Okay.
Yeah, I mean it's.
I want something that's not going to make me sweat. All of a sudden, I've started sweat. I've got flop sweat like crazy. I've never had this problem before, and I thought I was incontinent. It's like, am I pissing in my pants? I would only tell this story because I've discovered that I am not incontinent.
Right.
I did a test where I took gauze and toilet paper, wadded it up, and put it on the end of my, male membership, and then came back after I felt like I had pissed my pants, and there was no urine there. It's just sweat.
Well, but see, women are different.
No, I know.
So,
I didn't know. I thought you just
my God.
Oh, you're in trouble now, buddy.
Sorry.
You better tighten up. She's going to kick your ass.
And I like how it's a question for a woman, but then you go ahead and turn it around.
No. I was just talking about me.
Yes,
That's all. How does it affect him?
For fuck's sake. No, I'm empathizing with women. Go ahead.
So, I think the Lumi is good. I really do like it.
Yeah.
But it's not. It doesn't have an antiperspirant in it.
Yeah.
So, but if you spend all day out and you've had a couple of kids, I mean, by the end of the day, it can get kind of stinky down there. So
I've never noticed taste. That's what I'm going to say.
Okay, thank you.
Bed of roses, buddy. Bed of roses.
I did read.
That's what I would assume. That's what I would assume.
One time on Facebook, they were talking about this very subject, and one person wrote, "It's a vagina. It's not supposed to smell like flowers."
Right. I'm fine with that.
No.
Yeah.
It shouldn't smell like, 10-day-old rotten fish either. I mean, there's a spectrum there.
Yeah, there's a spectrum.
Right?
Somewhere in between,
so I would say,
the two, somewhere in the middle.
And I don't know if I've said this or not, but it does smell a little weird when you put it on, but that smell goes away. So
yeah.
I would recommend that
And
product.
It says it's baking soda free and aluminum free. We are not, they're not a sponsor of the show.
No. And so also, Steve, there are a lot of women that believe, and I don't know where I'm at on this, in the natural deodorants, because that aluminum can cause cancer in the breast.
I have heard that, but I don't know.
They don't want to use the antiperspirant.
They're concerned about it.
Yes.
Yeah,
so
and that's fair.
Where a lot of this natural deodorant stuff's coming from.
Totally understand. I'm looking at use of underarm cosmetic products in relation to risk of breast cancer case control study. And what this found was use of underarm. They're saying UCP. Let me see how they're. Okay, underarm cosmetic products. Yeah. Was significantly associated with risk of breast cancer, but the P was 0.036. So it wasn't, 0.05 is where we say, 1 in 20. So it was less than 0.05, but it's not strongly associated. And so I understand where people, if they are concerned about this and that they look at these kinds of studies that they made, that was from 2017, that people would be, hey, no, I don't want to do aluminum. Now, let me tell you what the American Cancer Society says about it. That cancer-causing substances and antiperspirants are absorbed through razor nicks from underarm shaving. They're said to be deposited in the lymph nodes under the arm, not able to clear them by sweating because the antiperspirant keeps you from perspiring. Well, that makes sense. Now, most breast cancers develop in the upper outer quadrant of the breast because that area is closest to the lymph nodes exposed to antiperspirants. This is the claim. Okay. And then now the American Cancer Society, which really I can't think of a reason why they would have a dog in this hunt other than the truth. They said no strong epidemiologic studies in the medical literature that link breast cancer risk and antiperspirant use. And there's very little scientific evidence to support this claim. That one study was one of those things, but that was it was pretty weak.
Right.
And it was not a perfect study. It says here, a carefully designed epidemiologic study of this issue published in 2002 compared 813 women with breast cancer and 793 women without the disease. They found no link between breast cancer risk and antiperspirant use. And I just lost my place
way
here.
to go.
Sorry.
But that's a big...
Yep.
A big thought amongst a lot of my friends. I have friends who don't wear deodorant. I have friends who wear natural deodorant.
And then the thing is, what's in the natural deodorants? Are there any carcinogens in those, too? And I would want to know about that.
They what they would say about natural deodorant is they just don't have the aluminum
Right,
stuff in
right.
it.
Here's one study that looked at the absorption of aluminum from antiperspirants containing aluminum chlorhydrate applied to underarms, found that less than 0.012% was actually absorbed, and the amount of aluminum absorbed would be much less than what would be expected to be absorbed from foods a person eats during the same amount of time, because there is aluminum in our food.
Mm-hmm.
So, and then it also doesn't seem breast cancer tissue contains more aluminum than normal breast tissue. Study that looked at women with breast cancer found no real difference in the concentration of aluminum between cancer and the surrounding normal tissue. So if you want to cherry pick studies, then there was that one study that showed some risk. Yeah. But if you look at the totality of all the studies, there's no evidence that this is a real thing.
Okay.
Now, so would I argue with someone for using a natural antiperspirant? No, unless there are people at work saying, I can't work next to you because you stink.
Yeah, you sweat like a hog.
And in that, sweat's one thing, but smelling's another. Yeah. And so if someone sweats a lot and they don't care if they have sweat pit stains, I'm fine with that. If they smell bad and people are complaining about them, those are the people that maybe I would say, you know what, maybe the risk of is worth the benefit, you know.
We've got to find a better solution.
Because I've known people, I mean, that's some real stuff where I've had people come in and say, hey, I smell so bad. People are complaining at work, and it's, what are you using? Well, I use deodorant every day. I use deodorant soap, but that's not enough for some people.
Yeah. Well, you know, Kim Chickens was saying, well, don't shave. Because you mentioned the nicking of the...
Well, that was the supposition that the reason. But yeah, go ahead.
Well, I was just wondering, in lieu of shaving, could you do Nair or waxing or something?
Yeah,
I don't know. I mean, I don't
waxing,
know.
Or you could just shave close with a shaver
trimmer.
that's got with a trimmer that's got a guard on it, and then you won't nick yourself.
I think that'd be a good idea.
I'm not grossed out by hair in a woman. And, you know, if it's hanging out down to their abdomen, that's kind of gross.
That's a little different.
But that's gross in a dude.
It kind of makes things stinky.
Yeah, yeah.
It does.
Understood.
Yeah.
Yep. So there you go.
Well, thanks.
Wow, was it good? What else you got?
That's about all I've got for now.
Well, those are good. Okay.
Yeah, thanks to our wonderful...
Let's do this one about a deviated septum. How about that?
Oh, cool, yeah.
Okay. Here we go.
Yeah, hey, Doc, it's Zach from Oklahoma. I hope you and Dr. Scott are doing well.
Thanks, man. I wasn't oh-my-godding about you. I was because I was afraid that the player wasn't going to play.
Got a question for the both of you. Maybe one of you can help me out. All my life, I've had horrible sinuses. I have a bad problem with allergies. I have a deviated septum, which doesn't help. I get bad sinus infections. Ever since I was in high school, I've always used Flonase.
Okay, that won't. We're running out of time. That won't help. A deviated septum. A deviated septum is a medical problem. Tacie had it.
Yes.
She had it so bad she had a thing called a concha bullosa and had to have it removed. And did you notice any difference?
I feel like I can drive a Mack truck up into my nostril.
If you get a good ENT surgeon, they know what they're doing, and you've had these problems your whole life, getting it fixed will change your life.
All the difference. And I mean, I didn't know that I wasn't breathing.
Right. Yeah. You don't know how bad it is until you get it fixed.
And I got a free nose job.
Yeah, and if you got a goofy looking nose, sometimes they can fix it while they're there and just call it medically necessary. So talk to your primary care or your ear, nose, and throat provider about that. You may be able to get that fixed. Anyway, what other questions you got there, Dr. Scott?
Yes, we got Bob. Old Bobo. He was asking about old Bobo. Actually, technically it's Bob M, but, you know. He was saying that last week we were talking about scoliosis.
Okay.
And he says he's 38 years old. He's got some scoliosis. One of his legs is about an inch shorter than the other.
Okay.
It doesn't bother me now, but I want to make sure it's not going to get worse.
Yeah. Okay. Well, I don't know why you made that noise.
Well, is everybody like that?
Well,
no, not to where it's clinically relevant. So, Bob? Do you know the degree of scoliosis that you have? Because there are different degrees.
Yeah, which
mine got worse. Mm-hmm. But what do you think, Dr. Scott? What are you going to say?
Well, I was
because you're the person that deals with this
number
stuff.
one thing I would say is a lot of stretching, a lot of back stretches, hamstring stretches, core strengthening, etc., trying to keep the pelvis as balanced as you can, try to keep that leg length discrepancy from getting too much worse.
Yeah.
Because it just goes right up the chain from your ankle to your knee to your hip.
And what about shoe inserts? If they're one leg is shorter than the other.
And certainly shoe inserts, we like to start small, 1/8 of an inch first.
Really?
Because you don't want to go up too quickly because that can really throw off the hip and the back. And so I think shoe inserts are certainly good, but the key is going to be just a really great stretching exercise plan to try to slow the progression.
Yeah. Yeah, Tacie is right, though, about, and let me give you one of these, Tacie.
Give yourself a bill!
More than 50% of people do have subtle difference in their leg lengths.
That's what I was asking.
That's what you were talking about. Yeah, okay. The
I didn't hear the
not
scoliosis
so much.
part.
So that is absolutely true. And most of the time it doesn't cause problems, but if it's more than a couple of centimeters, so 2.5 centimeters is 1 inch, then it can affect your quality of life for sure. And these things can be caused by a lot of things, bone infections, bone disease, but in Bob, of course, it's caused, we think, by his scoliosis. And they should do x-rays and all of those things to look at these things and line everything up, make sure that there's not something that they can fix. And wearing a shoe lift is one thing. Like Scott said, you probably start small and work up. But then surgery is a possibility, but that's usually done in people who have this when they're a child, so that they can either stretch one of the limbs or cause one of the other ones not to grow as fast. And, so in children who are still growing, there's a thing called epiphysiodesis. And what that is just basically you're trying to slow down the growth plate in the longer leg. And then you can do lower limb shortening. You can do lower limb lengthening with a thing that looks like an external fixator. And then they just keep screwing that
separated,
what's it called when you turn a turnbuckle? It's got like a turnbuckle on it, and they'll keep screwing it to try to straighten that limb. But honestly, the best place to go is either it was to an orthopedic office. Let them, preferably one that's got a spine surgeon in the center.
If you do ortho and if it's neurosurgeon, of course.
Yeah, well, I'm just saying so that they can both look at it and say, yes, you don't need to do anything. That's what we're hoping is they'll say you don't need to do anything, and they'll send you to an orthotic shop and they'll get you a lift in the short legs shoe.
Yeah, I guess his Cobb angle, he says, is 49. Which is
what's 49?
49 is pretty significant.
Wow.
Yeah.
Okay.
And a talk like you would, what amount would make it clinically relevant?
What's that? The scoliosis?
I guess in scoliosis, yeah.
Well, like we said, more than a 1 inch difference in leg length can affect your quality of life. And then, it's, I don't know, it's
anything greater than 10 degrees is going to start to be a mild scoliosis.
Yeah, let's look up. Let's grade scoliosis here.
Yeah, it's the Cobb scale, Cobb angle measurement.
Or did you look that up? So you have the answer in front of you.
Yeah.
So why am I struggling here? So what is it? So you said 10 is mild.
Yeah. So 1 to 9 is
normal.
Is normal scoliosis or very mild. 10 to 24 degree curve is considered mild scoliosis, needs to be monitored. 25 to 39 degree curve is considered moderate. You get up to 40 to 49 degree curve generally is considered a brace to avoid surgery.
Yeah.
And then getting up past that, you start looking
at
and
he was
50 to 70.
He was in that grade 3.
Yeah.
Okay.
Yeah. So yeah, they're suggesting bracing and certainly bracing.
I'd get this looked at.
Oh yeah, and I'm sure he has. He said they found it when he's in 9th grade. So
okay.
So he's been.
So he's been living with it all this time, and he just wonders what's going to happen later. Well, I can tell you this, by God, that mine got worse as I got older. I'm about an inch shorter than I was when I was in college. And it has caused me to have some difficulty. So you want to have someone that's monitoring this over time.
Yeah, of course, you're twice as old as Bob. So that's
how old is he?
He's 38.
Oh, yeah. Okay.
Thanks, Bob.
Not quite twice as old. All right. You got anything else?
Nah, that's a bit. Hey, thanks, Bob. Just keep doing.
Yeah,
those
Bob, keep
stretches,
us in the
man.
loop on that. I would like to know how that turns out and what they say if you do some further monitoring. All right. Well, let's get out of here, Dr. Scott. Thanks. Always go to Dr. Scott. Thanks, Tacie. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, That Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Dolly Museum Diddler, the Ballet Bimbo, the girl with the genetic half-sister no one knows about, Percy Dumb, Roland Campos, sister of Chris, Sam Roberts, she who owns pigs and snakes, Pat Duffy, Bill the Cop, Keith the Cop, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's voice double, guitarist Steve Tucci, the great Rob Bartlett, Adam Goldstein, Car Girl Vic, thank you for your service, Cardiff Electric, Casey the Soil Scientist, Karl of the Talipes Equinovarus Carls, producer Chris, the subreddit news chick, a.k.a. That
Oh my God, it's like the whole
Crows
show.
and the Bukkake Queen, Jenny Jingles, the inimitable, Vincent Paulino, everybody.
It really is bad.
Eric Zane, Trucker Andy, Tucker and Anita Dixon, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, of course, our dear departed friends, G-Vac and Barry the Blade, and Todd Hillier, who supported the show, was always gracious and always appreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com. Okay. Nobody listens this far anyway. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Don't take those headphones off yet.
Why not?
That's what